Good afternoon and welcome to this Genetic Alliance webinar. Today's webinar is a Strategies for Success webinar entitled Creating Collaborative Publications, a Guide to Genetic Counseling. So today we'll be talking about a new publication called Making Sense of Your Genes, a Guide to Genetic Counseling. The guide includes general information about genetic counseling, tips on how to prepare for an appointment, and details about different specialties in the field. This was truly a collaborative process, and the publication was born out of a partnership between Genetic Alliance, the National Society of Genetic Counselors, students at the Johns Hopkins University National Human Genome Research Institute Genetic Counseling Training Program, and a number of independent advisors and reviewers. So today on the webinar we have a representative from each of these partnering groups. We have Lisa Scheuer, who's the parent of a child who had Costello syndrome. She's past president of the Costello Syndrome Family Network and also a lifetime trustee for the International Costello Syndrome Support Group. This summer she's working with Dr. Catherine Round on the first genetic syndromes of the RAS-MAPK pathway. We also have James O'Leary from Genetic Alliance. James has recently transitioned to a new position within Genetic Alliance as the Chief Innovation Officer. He works to foster systems of openness and innovation both within Genetic Alliance and also within the broader genetics and health community. Jillian Hooker recently graduated from the Johns Hopkins University National Human Genome Research Institute Genetic Counseling Training Program. She is currently the project director and a genetic counselor at Georgetown University and Lombardi Comprehensive Cancer Center. She's interested in behavioral and psychological outcomes of genetic counseling and testing for adult onset conditions such as cancer and patient decision-making following genetic testing. We also have Angela Trepanier from the National Society of Genetic Counselors. She's the immediate past president. She is also the director of the Wayne State University Genetic Counseling Training Program and assistant professor of molecular medicine and genetics. She has 14 years of clinical experience, primarily in cancer, adult, and prenatal genetic counseling. Just as a reminder to the participants on today's webinar, all of the participants are muted, so if you have any questions or comments, please type them into the webinar software. There's a box on your screen where you can type in questions and comments, and at the end of the webinar, we'll read them out loud to the presenters, and they will answer them. So let's get started with Lisa Scheuer.
Hi, everyone. I guess I was thinking of 4 different places or times in my life where I wish I had had a genetic counselor or access to genetic counseling. And the first time actually was when I was pregnant and went to my first obstetrics visit. And right after we sat down with him, he said, "You'll want an amnio. I've noticed my clients under 40 years old are the ones who have children with Down syndrome. You're a young couple with a great future, and I'd hate to see you held back by a disabled child." It was what I was thinking before getting pregnant, but it was really shocking to hear it from someone else's mouth who didn't really know me, and it didn't sound quite right. And now, of course, knowing all the options, it's sort of awfully narrow-minded. The second time, I think, was when we were in the hospital right after my son was born, and a geneticist came in to look at our ears and toes, and he mumbled words like gross facial features and low-set anti-cruce earlobes and stuff like that. And I said, "Well, what do those mean?" And he kept saying, "Oh, don't worry, don't worry." So that was early on in the first level of efforts to diagnose, and it did take 13 months to diagnose him with Costello syndrome. Once I got the diagnosis, I got onto the internet and met a father who ran a website and listserv. I think there were under 10 when I joined, and now it's over 100. And we have parents coming to the listserv who tell us their interpretation of what their geneticists told them. And a number of them come with information telling them that they shouldn't have any more children because they think it's autosomal recessive. And that, now with my exposure to everything, I know is wrong, but certainly I feel much more confident now with this resource to be able to say, take a look at this resource and find someone to help you navigate better. And here are some articles which indicate that it's not autosomal recessive. And then in the last couple of years, with the understanding of the shift of Costello syndrome's relationship to CFC syndrome and Noonan syndrome, which have been sort of the constellation of syndromes that our children have been bounced back and forth around for diagnosis, the shift has gone from the gene mutation locus, looking for locuses that are close to each other, to actually to their cellular function. So treatment is on the horizon, which is really fantastic. And with genetic counseling, I think we can, our support network can encourage our families to get CLIA-approved lab testing so that we can move forward towards clinical trials. So everything is very timely these days. Fantastic to have this. Thank you.
Thank you, Lisa. This is James O'Leary from Genetic Alliance. I want to thank everyone for being with us today. Today I want to talk a little bit about the collaborative process that led us to this publication. It was certainly an extended one with a lot of players, and I think that's what led us to have such a good result. So to start off with, I want to talk a little bit about why Genetic Alliance was interested in participating. Genetic Alliance's mission is to transform health through genetics, specifically looking at creating an environment of purposeful openness, creating novel partnerships and advocacy, integrating individual, family, and community perspectives to improve health systems, and to revolutionize access to information to enable translation of research into services and individualized decision-making. This project touches on numerous different goals of ours, specifically looking at novel partnerships, but also really looking at informed decision-making, giving people the tools that they need to reach out, to make the proper decisions, to get the correct services, and to get the best health outcome at the end of the day. The original project was formed with the National Human Genome Research Institute Johns Hopkins Genetic Counseling Program, and started off very open-ended. The goals and objectives of the partnership were to set up an educational partnership between that program and Genetic Alliance, to create a product that allows informed decision-making, and to engage new stakeholders to transform an existing health system. So that's pretty open-ended, but within that, the goal was to let the students at the genetic counseling program come up with their own project that they felt would make that impact, and for Genetic Alliance to work with them and their class on that type of project. So the project description itself was a project that comprised the development of an article, web page, booklet, et cetera, dealing with an issue of interest to genetic counselors and consumers. The project would require thorough research into the topic chosen, but would also necessitate input from advocates, genetic counselors, and other health professionals. Generally, the intended audience will be advocates and consumers, and the final product would be used by members of the Genetic Alliance network. You are encouraged to work in a group. I mean, it really was it started off as a smaller project, but with the goal of tying that into the resources of Genetic Alliance and all of its partner organizations to really make it something that would have broader impact within the community. So I include this basic timeline, and I'm sure that Jillian is laughing a little bit because this is the initial timeline that was submitted as part of the project and that we all agreed on as a group. And actually, the specifics aren't that important, but the goal was when the project started, the actual class started in October of 2006, was to have the guide complete by Valentine's Day of 2007. Now, they didn't put these years in here. I added these, but they actually delivered. But it turned out that the entire process, the entire review process to get to all of the great results that we've had to date wound up until this Valentine's Day. So they still hit their goal, a good Valentine's Day project. We actually met this timeline very closely all the way up until that final completed stage. So the actual class development of the draft did very much match this I think it's a 5-month timeline. But as many of you know who work on collaborative publications, who work on collaborative projects, there's a lot more steps than just the initial draft phase. A very important part of this project for Genetic Alliance was to make sure that multiple stakeholders were involved. So this is the project phase we went through for this particular publication, for this particular project, really looking at that initial partnership, looking at the student development and leadership of that project, to do brainstorming, initial brainstorming, and pull in some relevant partners and feedback, and then to really look at, for this type of publication that's aimed at consumers, it's aimed at advocates, who are the stakeholders? Who needs to be brought into this process? And really for the formative review process, we really looked at it as important to do interviews before the writing even got started with 5 different advocates, disease-specific advocates, as well as 5 different genetic counselors. So that was the next step for the students to reach out, to do those interviews, to form the basis for what was going to be included in the guide. Next was the draft, and then to really bring that draft for the publication back around to those people who were interviewed, to get their feedback, get their comments in the direction that the further draft could take, but also then to bring that out to the larger stakeholder community. And this was very much where NSGC played a pivotal role as well, bringing their wealth of experience to the review process, and also to what is not just useful to consumers, but what would be useful to genetic counselors in their work with other types of providers, other specialists, and also with patients that they work with in their practices. This whole process took all the way up until the spring of 2008. So we're talking about then another whole process where we're looking at putting that content within a framework that was usable for patients and for genetic counselors. The initial way that we got this information out was a wiki version, which is currently within Genetic Alliance's Wikigenetics. Wikigenetics, the idea was that this information could grow and change, and that we wanted to get it out there as available because we knew that people already needed this information. In addition, though, we wanted to make a very user-friendly version that could be distributed, that was a print version as well. Genetic Alliance really likes to focus on mixed media, really reaching out to people in different ways, making things customizable, making things accessible. So we went through a almost year-long, about an 8-month review process, a graphic design process, and then really reaching out with NSGC to do co-branding, to look at kind of novel ways to do dissemination, and then to kind of wrap that up into the current version that you see today. And I think that NSGC will talk, Angela will talk a little bit more about the dissemination plan for this project. I do, though, want to touch upon the importance of the partnership between the students at NHGRI, Johns Hopkins program, NSGC, and Genetic Alliance on this effort. Certainly, multiple stakeholders for publications that really reflect the users, I think, are the most important at the end of the day, to make sure that all of those groups have a stake and make sure that all of those groups are involved. So at this point, what I'll do is I will turn it over to our next speaker, who is Jillian Hooker from the National Human Genome Research Institute, Johns Hopkins Genetic Counseling
Program. Hi, I'm just waiting to pull up the guide. But while I'm doing that, I just wanted to say that I'm just really excited that this has turned out as neat as it has, and that I get a chance to share the guide today. I think it's been interesting watching the evolution of it, because it, in a lot of ways, sort of paralleled my classmates and I's understanding of genetic counseling. And one of the reasons we gravitated to this project early on was because we were really in the process of finding our own definitions of genetic counseling and understanding how to present genetic counseling as a field and as a practice. For my part, I'm going to focus on what the guide actually says and the content we put together, talking a little bit as I go through it about why we included the things we did after our conversations with the advocates and the counselors, and why certain things are written the way they are. I think very globally, once we got started with this project, we really had to start thinking beyond just our own views of what genetic counseling is and what it should be, and come up with a document that really reflected on a broad scale what the experience might look like in a way that really represented the broad spectrum of genetic counseling and genetic counseling practices. At the same time, we wanted to be specific enough so that people using this guide could really anticipate what a counseling session might look like and really have some useful information to get ready for their counseling session. So we kept in mind throughout the development and writing of the content that the overall goal was really to help people gain access to genetic counseling services. And with that, it meant that it had to be accessible, had to be relatively jargon-free, and then it also had to provide language that would help somebody track down the right kind of information. And what I mean when I say that is that knowing that a genetic counselor who sees women who are pregnant or who may become pregnant typically refers to themselves as a prenatal genetic counselor is probably a useful bit of information to have if you're trying to track down that kind of person. So James mentioned all the stakeholders and the people we talked to early on, and I think our initial conversations with genetic counselors, with the Genetic Alliance, and with advocates were also really key to maintaining this dual agenda of conveying both information that genetic counselors really would want their patients to know, but also providing information that advocates that we talked to thought their constituents would want to know. And I think this also raised some challenges, was that language and viewpoints weren't always shared by all of these groups, and so finding ways to reconcile that was a very interesting process. Okay, so from here I'm going to walk you through the guide, which you should be looking at right now, the cover of the guide, Making Sense of Your Genes, a Guide to Genetic Counseling. And we started out, there's the contents page, we started out just wanting to broadly define genetic counseling, providing from the perspective of the person reading the guide, what would an interaction with a genetic counselor look like, and what are the different things a genetic counselor could do for the reader. We also wanted to introduce right up front that there are different types of genetic counseling, and that genetic counselors are used in different situations and different life scenarios, and so it presents a number of different scenarios where somebody might see a genetic counselor. On page 2, this list continues of different scenarios or reasons you might see a particular type of genetic counselor. And then we incorporated very globally some ideas to think about in getting ready to prepare for a genetic counseling visit. I think that really the most important message right off the bat up front about this was getting readers to think about what they're going to get out of genetic counseling, so that when they do get in to see a genetic counselor, they can spend the time they have there focused on the topics that are really most useful to them. And this idea carries through into the next page, where the reader is prompted to think about what topics they might want to address during their visit, given this list of commonly addressed topics in a genetic counseling visit. And I think that this list also highlights the theme that I mentioned earlier, with the goal of being as all-inclusive as possible, while also balancing specificity and being able to give a picture of what how a conversation could go, that there are really multiple different aspects of living with genetic conditions that genetic counselors work with, and also living at risk for genetic conditions. And then finally, at the bottom, reminding, again, using that message, carrying that message through, that the participant, the reader, whoever's seeing the genetic counselor, the patient, that their input is really what's important. And then we provide some examples on page 4 of questions that someone might ask a genetic counselor. I think a number of these questions are really aimed at helping the reader navigate the system, so to speak, drawing attention to the fact that a genetic counselor can really serve as an ally in understanding risk, and as mentioned specifically here, seeking genetic testing, getting insurance to cover genetic testing, and understanding the outputs of genetic testing. So that was sort of the introductory part of the book, and then from there we broke into specialty fields, providing even more specific information about different specialties in genetic counseling. As I mentioned earlier, a lot of thought was really put into the specific language used in this guide, and I think that the prenatal genetic counseling section is a good example of that. One of the advocates that we talked to pointed out that many of her constituents were really more likely to see a genetic counselor prior to having a baby, and suggested that we use the term preconception genetic counselor. And we definitely agreed that it was important to acknowledge that a lot of people do see genetic counselors prior to having a baby, and that including that language in the description of prenatal genetic counseling was important, but really felt that it was important to maintain the term prenatal genetic counselor because that's a term that would really help readers access those services. Echoing the format that we used in the first part of the guide, we start with generally defining this area of genetic counseling and some of the things that are specific to this area of counseling, and then go through some of the scenarios or situations where somebody really might seek a genetic counselor. On the next page is described what might happen during an appointment and what one would do prior to coming in for a genetic counseling appointment, and specific information that one would want to prepare, and information even that's more likely to be discussed in a prenatal session than in a different kind of genetic counseling session. And here, more information about what might happen during an appointment with topics that might be discussed and pregnancy-specific topics that would be discussed. So this next section of the guide is the general and pediatric genetic counseling section, which again describes sort of what's characteristic of this type of genetic counseling, addressing that general genetic counselors or genetic counselors in a pediatric setting often work with teams, often work side by side with physicians, and that may be one aspect of the appointment. Possibilities for the actual appointment were described, and then also information about getting ready for the appointment and information to put together before one comes in. Okay. And then, like with prenatal, we also provided a list of things that may happen during the actual appointment to provide some anticipatory guidance about that. The next section, we addressed psychiatric genetic counseling, and we chose to highlight this growing subspecialty in genetic counseling, in part because some of our own interests in that area, but also to present a field of genetic counseling where there's really a lot to be gained from genetic counseling independently of genetic testing. And as was listed for the other specialties, the format is the same, things to do to prepare for genetic counseling in topics that are focused specifically on mental health history. There's also explained sort of how the counselor would use family history information to assess genetic risk, and talk about what one does with risk and how one deals with risk. The final subspecialty that we included in the guide was cancer genetic counseling. And this section starts with an exploration of who might want to see a genetic counselor, and then highlights risk assessment and genetic testing, as you would often see in a cancer genetic counseling session. The next page lists hints, helpful hints or tips on what to bring to the appointment, ways to prepare, highlighting the importance of knowing the types of cancer that the reader or the reader's family members have had and the age when they were diagnosed. There's also an important comment in this section on the implications of genetic counseling for family dynamics and family members, and encouraging the reader to think about that as well when thinking about genetic counseling. The guide also, let's see, one more page. As with the other sections, talks about what might happen during a genetic counseling session. Again, noting risk assessment as a component of that and discussions of testing. The list continues on to the next page and talks about how results may be received or interpreted. And also some of the things that are a little different about this subspecialty from some of the other subspecialties that we've talked about. So at the very end of the booklet, it's acknowledged that we didn't cover all subspecialties of genetic counseling. That would have made for a pretty long book. And so we list some of the topic areas, subspecialties in genetic counseling that weren't covered that are also available, and then provide a link to NSGC for individuals who'd be interested in learning more about that or for information about genetic counseling as a field. The next page provides important references to the Surgeon General's Family Health History link, and also to the Genetic Alliance's Family Health History Project, and then to the PDF file link as well. The final pages are acknowledgments of all of the many people, as James mentioned, who participated in this project, that it really started as a class project for our first year genetic counseling practice class, and then with the help of a lot of people along the way has evolved into this guide today, and they're all acknowledged here on these pages. And that's the guide. With that, I'll turn it over to the dissemination plans.
Thank you very much, Jillian. While we're switching over the slides to the next presentation, I do want to remind folks that the guide is available for free for download off of the Genetic Alliance website, geneticalliance.org, and I believe it will be soon available off of the NSGC, National Society of Genetic Counselors website as well. And I'm sure that Angela can point everyone in the right direction.
Yes, it actually is available on our website already. It's on the homepage today. Okay, so I'm going to talk about our dissemination plans from the NSGC perspective. And I'm giving you some specific dissemination plans for 2009, but I'll also speak in general about how we'll approach dissemination in the future. But we wanted to really thank the Johns Hopkins University NHGRI Genetic Counseling Program and the Genetic Alliance for this opportunity to partner on reviewing and then also distributing and disseminating this booklet, because we feel like it's a tremendous member benefit for our members. We feel like it is in line with some of our strategic initiatives. I think it will go a long way in terms of increasing the visibility of the genetic counseling profession, which increasingly is becoming important as more and more people have access to genetic testing through a variety of mechanisms. And in order to develop a document that's really valuable to the target audience, a collaborative approach is really necessary. And so that's one of the reasons why we saw that there was tremendous value in this booklet, because of all the stakeholders that were involved in its development and its review. And so now that we have this booklet, this resource, it's very important that we take a collaborative approach to dissemination as well. And so I'm going to present our preliminary dissemination plans, but anyone who has feedback about additional ways to disseminate this brochure, this booklet, NSGC would love to hear from you. So in terms of our dissemination efforts, first we're going to highlight, and we already have it on our homepage, and it will also be in our provider section, the document, the brochure, and we will also be putting it in our NSGC weekly update. Every week we send out an update to our members, letting them know about some relevant information that they could use in their practice or in other ways. And so this will be included in our weekly update this week, and as I mentioned, it's on the homepage as well. We are also distributing the resource to our state chapters. Currently there are 2 NSGC state chapters in Texas and Michigan, and we hope that these will be useful in licensure efforts, but also in making sure that locally people have access to the resource. And then one of NSGC's strategic initiatives is to increase access to genetic counselors by pursuing billing and reimbursement, which is one of our issues. In terms of integrating genetic counselors into practice, billing and reimbursement can be a challenge. And so we have some federal advocacy efforts and state licensure efforts that we can use these booklets for in terms of giving them to policymakers and other individuals who are helping with these efforts. So I think this is an excellent booklet that describes what genetic counseling is. Our experience in being out and talking to legislators and their staff is that they really don't know what the profession is all about, and I think this book defines it very clearly. Now, when we are making any plans to partner with other organizations or to use resources to do something like disseminate this booklet, one of the things we go to, two of the things that we go to is our mission. And the mission of the National Society of Genetic Counselors is to advance the various roles of genetic counselors in healthcare by fostering education, research, and public policy to ensure the availability of quality genetic services. So this booklet clearly fits within the Society's mission because what it will do is it will foster education to healthcare providers, to consumers, to other audiences about the genetic counseling profession and the value of genetic counseling in terms of considering genetic risk assessment and testing and dealing with a genetic condition in the family. So it clearly fits with our mission. We also are guided by our strategic plan, and one of our strategic initiatives for our current strategic plan is to position genetic counselors as key players in the integration of genetics across the healthcare spectrum. And one of the issues in integration is that we felt and specifically stated that it was important to pursue partnerships and activities that support the vision and mission but that enable us to contribute meaningfully to policy discussions, but also to increase the overall visibility of the profession. And we feel that this booklet will make tremendous strides in doing that. The fact that it's available in multiple different formats, it's not just something that's available as a print copy, but the wiki version, and also the fact that it's available by PDF, and that so many people have contributed to it, and that so many people are contributing to the dissemination plans makes this a really amazing resource and fits very clearly with that strategic initiative and that strategic goal. In particular, what we're planning to do in 2009 is we already know that we will be attending several meetings on behalf of the organization. So specifically in 2009, we're planning to disseminate this resource at the American Society of Clinical Oncology meeting, the American Academy of Neurology meeting, the FORCE meeting that we're exhibiting at, the Facing Our Risk of Cancer Empowered. And then also we have a relationship with the American Association of Family Physicians, and we will be distributing the resource or notifying them about the resource as well. And these are specific examples. Our dissemination for this year is not limited to this list, but these are the ones that we know that we're planning to use it on specifically this year. And then in terms of broader dissemination, our plan is to reach out to the list of providers below: Informed Medical Decisions, 23andMe, Navigenics, Decode, and any other companies that come down the pike that are providing genetic testing or genetic counseling services to consumers, because we feel that consumers who are using services, especially with direct-to-consumer genetic testing, may not fully understand what's available in terms of genetic counseling after they've had a genetic test, or how that could be of value to them, to some people at least. And so by reaching out to these groups, we're hoping that that will increase awareness of the value of genetic counseling and risk assessment, so that people appreciate that it's more than just genetic testing that can lead you to an appropriate risk assessment. And then NSGC really recognizes the value of collaborating to extend the reach of our organization, and this was a tremendous opportunity to work with the Genetic Alliance and the NHGRI Genetic Counseling Program, and then the other organizations that Genetic Alliance represents. And so we really appreciate this opportunity to partner on this, and we look forward to working with everybody involved to make sure that this has a wide audience. Okay, and I'll turn it back over for questions. What's next?
Okay, excellent. Yes, this is James again. And at this point, if you haven't already, we already have some great questions. Please send your questions using the chat box on the right-hand side of your screen. And then we will go through the questions and give them to all of our great presenters to respond to. Also at this point, I do want to say that if you're interested in receiving print copies of these booklets, you can contact Amelia Chappelle at Genetic Alliance. We will put her information up shortly. Her email address is achappelle, that's ACHAPPELLE, @geneticalliance.org. And you can order bulk copies from Genetic Alliance. They are also, I believe, available from National Society of Genetic Counselors. So first off, we have a question. If you did this project again, what would you do differently? So I will throw that out to our speakers, and I'm sure I have a few thoughts on that as well. So perhaps, Jillian, do you have any thoughts on that?
Yeah, I'm just trying to think through how it went. I do feel badly sometimes about that subspecialties we didn't include, and wonder if we'd had a larger content team and a little bit more time, that if we could have included those and made it really a bigger reference. But that has upsides and downsides.
I think one of the interesting things about this project is there were a lot of benefits to this project beyond just the resulting publication. And so it's tough to answer a question like this because there are so many benefits through partnerships, through collaborations, through information sharing, through learning, I think, through the program at NHGRI Johns Hopkins, which was one of the major goals of this project. I think that if we were going to do the exact same thing again, certainly looking at the timeline would be my biggest goal, would be just to know immediately what types of requests we would have of those reviewers. I think we were pretty clear on wanting their feedback for interviews and wanting reviews, but it might have helped maybe put a little bit more strict timelines in place for those. Because as with having this many people review things, that turnaround is always an issue.
Yeah.
The next. Oh, go ahead.
No, go ahead. I was just going to agree with that.
The next question is, this project took a lot of time. I haven't got that much time. How can I do this? And I think specifically with regards to this booklet, we have tried to create something that's available and useful to people in different forms. The wiki is available immediately if people want to add in new condition information, to add related resources, etc., at wikigenetics.org. But if I were to say, how would I do this again in a shorter amount of time, Genetic Alliance, beyond this webinar, is also happy to share kind of the slide that I shared on process and how to best do that, and also to reach out to existing networks is a real strength, to make sure that you pull in those reviewers right away. I'm seeing the next question coming down the line here, which is there are multiple stakeholders are important, but that also means more issues. What is the trade-off? I think that is the trade-off, and the trade-off really comes strongly in the quality of the resource, but also in the dissemination plan. Angela, do you have any thoughts about those two questions specifically? I guess the amount of time, but then also the benefits of multiple stakeholders?
I think in terms of the time issue, if you can do a project like this with multiple individuals involved, then I think that takes away a little bit of the time issue in terms of individual commitment to a project. I mean, the timeline is longer because there are multiple people providing input at various points in the process, but then it takes less impetus away from one person to be solely responsible for driving the project. And so I think the way this worked, and I can't speak to all the work that went on before NSGC got involved, but it seems like that's an excellent way to structure a project where you have lots of people involved, as long as somebody is driving the ship and knows what's happening. In terms of the trade-off, absolutely there is a trade-off, and I think what the developers, the people who are chiefly responsible for the product, have to sort of decide when to draw the line and when one, to decide whether a comment is taken out of context of the rest of the comments they've received, and when it's actually a comment that needs to be incorporated into the final document. And obviously, you're not going to please everybody, but I think in this case, the end product turned out very strong. And no, not every specialty could be represented because of the length of the document, and I think probably it isn't necessary to do that at this point, because I think the number of specialties in genetic counseling will continue to increase. And so this document as a publication can't ever be completely comprehensive. But I think that the way they structured it and having a team leader sort of overseeing everything is probably the best approach to these types of projects.
Definitely agreed. Lisa, how was it from your standpoint as participating as kind of an interviewee, a partner on giving feedback on the direction of the project, but also as a reviewer of the publication?
It didn't seem, it's kind of a familiar experience that I've had, and actually that I do myself and have done in my own field, or my salaried position, I should say. So I was really, actually, I was greatly appreciative that I was brought in from the beginning instead of at the end to make suggestions that were probably, would often be too late because there was a commitment already in the path and direction.
Excellent. Jillian, did you have any other thoughts?
I don't think so. Just that, that the time was something that was really valued in a way. As long as it took was maybe a little bit frustrating on one hand, but on the other hand, I think we got more out of it because of that as students and as people thinking about this problem and creating this project.
Great. The next question that we got was, well, actually, I see a number of questions on the subspecialties. One is, can genetic counselors and other specialties not mentioned in this resource work with NSGC Genetic Alliance to create a version with information about their own specialty? My initial reaction to that is absolutely. Genetic Alliance is all about customizable resources. We do try and make things accessible to different audiences, and we do try and, we have a lot of experience working with our graphic designers to do that. Certainly, I know that there are different issues for something that's going to be approved, with the NSGC and Genetic Alliance logo. That's always an issue, but I think that we'd absolutely be open to that. Angela, what are your thoughts on that question?
Yes, I think we would be open to that, and so if somebody does have a suggestion for incorporating some specific information, I would approach NSGC to figure out how that, and the Genetic Alliance, to see how that could happen. But absolutely, I think that especially there are some of the specialties that are up and coming, and we really want people to know that these specialties exist. So I think it would be in line with NSGC's mission and our strategic initiatives to consider such opportunities.
Absolutely. So I absolutely recommend that you contact Amelia as an initial point of contact, or Angela, who's the best person to contact at NSGC?
Megan Carey, the Executive Director.
Okay, excellent. And we can send out some information after this call, too, to all the participants with contact information for those individuals. The next question that I have here is, are there plans to translate this into Spanish? As with any resources, translation should always be a goal. It's certainly a goal of ours to translate this publication and many of our other publications into Spanish. At the same time, we are also, Genetic Alliance is also working with the National Council of La Raza to try and seek funding to do a really Spanish language needs assessment to really get an idea not just of kind of producing resources, but how resources need to be specifically tailored in addition to being translated. So those are both on our radar for next steps for this project. The next question is, has the guide been used in a clinical setting yet, whether to consumers or physicians? And I think that certainly some of our reviewers had that specific slant in mind, but Angela, do you want to talk about that specifically in terms of the dissemination plan?
In terms of?
Were there any clinical settings in the, that you were specifically looking at or that you've had requests from to use the guide?
I don't know that we've had any requests yet at this time, but the clinical settings that we're going to initially start working with would be just general family practice physicians, because we have an existing relationship with them, and they're increasingly seeing, having patients ask them questions about genetic counseling and genetic services. And then we had some existing opportunities. We work with ASCO, or we have a lot of genetic counselors that work in cancer genetic counseling, and so we felt like they would be a good place to distribute this, because of the number of cancer genetics tests that are available, as well as the new sort of level of testing that's available for multifactorial susceptibility to cancer. And then neurology also, because of the number of genetic counselors that are practicing. But I think there are many, many more opportunities. I know this document doesn't speak specifically to cardiovascular genetic counselors, but that is definitely an up-and-coming area, and so some sort of outreach to them, because I think the general information could still speak to what value a genetic counselor brings to the team when you're looking at cardiovascular disease risk assessment. But I think the possibilities are really endless.
I think absolutely, too, one of the things we're always interested in with these types of publications, because, as Angela said, the situations where people are getting genetic counseling, the types of conditions and care they're getting with regards to screening, but also specific diagnosis change, that these resources, we're always looking for opportunities to evaluate their use as well. The usability, their potential to increase informed decision-making, and that is something that we're committed to with all of our publications over the long haul.
And I think the other place, these are not necessarily providers in terms of healthcare providers, but disseminating this information to the direct-to-consumer testing laboratories, because they have access to groups of individuals that we might not ever see in genetic counseling at this point. So to let them know that this resource is available so that they understand a little bit better what it is that we can offer to people who have had genetic testing and then have questions, and then let consumers know that this is available in case they might want to do maybe the more traditional route to genetic testing, which is counseling versus then genetic testing, or at least figure out what to do with their information after genetic testing. I think that's a good way to sort of partner with these groups that are providing genetic testing to let them know that we're here as a resource. And when I say we, I mean we collectively, the Genetic Alliance, the NSGC, various organizations that are supporting the integration of genetics into practice.
I think that there's another question on here that answer brings to mind is how to get coverage for genetic counseling services covered in the guide in any way, particularly if health disparity, lack of access is an issue. I think that, as is recognized in the question, it's a tough question, and one that's very complicated. I think that one of the things that we tried to do was provide resources to organizations that could help with that, whether they be disease-specific organizations, but also to try and link people through this partnership to parent-to-parent networks, to resources that will help them find that information, including genetic counselors. Did anyone else on the call have thoughts about that specific question about the coverage of genetic counseling services?
It was something that we thought a lot about how to present and wanted to make sure that we presented it in the sort of most broad way possible so as not to be too specific to any one setting since it does vary, but suggested contacting counselors to talk about how coverage might work, or contacting your insurance agent before going into it to find out how that might work if they're, if that were appropriate.
Okay, another question that we had here was how did you find an illustrator or graphic designer? So for this project, Genetic Alliance used our graphic designer, Melissa Allen, who had worked with an illustrator in the past that we worked with for this project. In terms of working with graphic designers, I believe we actually have done a webinar on that in the past as well, so there should be more information on our website as well as well as in Wiki Advocacy, wikiadvocacy.org, which is a online wiki with resources for the advocacy community on largely capacity building, how to form a group, how to do fundraising, and all of the things in between. I would recommend for a project like this that you use some of the resources on our website, but also on other publicly available resources on how to determine what the feel you're looking for is, what are types of imagery are accessible, but also absolutely to work with a professional graphic designer in your area that you can meet with face-to-face, work with one-on-one. You may find that if you email out to your networks and to your colleagues that you already know somebody. Frequently, there are a lot of genetic counselors that partners work with as well, that if you just reach out to the partners and see who they have a relationship with, who they've liked, that can be an excellent way to find a graphic designer. And then there was one specific question, which was which subspecialty would address complex genetic diseases such as diabetes?
So I think I think you could, psychiatric diseases, clearly psychiatric disorder genetic counseling fits under that complex. I can't think of anything more complex than trying to understand the genetics of psychiatric disorders and what genes are involved in those types of things. I think cancer genetic counseling as well is an example of complex disease, although there's clearly a single gene component as well. So I think some of the elements that you find in cancer genetics, in the psychiatric genetics areas of this booklet speak to complex disease.
And I certainly think that the general genetic counseling section, which is the first section, a lot of the questions, a lot of the things that will happen and things to prepare for a genetic counseling session are common across the different subspecialties as well. Question that I have here is how can we find out about future webinars? And also a question about a request if we're interested in help with dissemination. And I think that absolutely, 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 this is a community-wide effort, and we would appreciate any help with dissemination of the guide. If you have any questions, please contact Amelia Chappelle at Genetic Alliance or Megan Carey at the National Society of Genetic Counselors, which we will send out those specific contact details and also put some of them up for you to view.